Imagine living in a place where zip codes predict life expectancy better than genetic codes, where untreated cavities are the leading cause of school absenteeism, where nearly half of people over age 30 have gum disease, where poor children die from untreated tooth decay. You don't have to imagine it. You live here. But our focus is not on what's broken in America's healthcare system. Ours is a story of solutions. We invite you to learn about a dental education and care delivery model that has been an enduring success for 5 decades in the United States. A program that helps improve lives here and can be replicated elsewhere. Whether as a resident, faculty member, clinical training site, or grantor, we invite you to join NYU Langone Dental in our mission to impact the hidden healthcare crisis in America: oral healthcare. The postdoctoral dental residency education model that started as Lutheran dental medicine was created by Dr. Neil Demby in 1974.
Dr. Demby was ahead of the curve. Not only did he see the need for affordable, quality dental care, he was able to do something about it in a way nobody else ever would have thought of.
Dr. Demby combined postdoctoral dental residency training with society's mounting need for affordable, quality dental care.
I wanted to provide service to those who needed it most.
It is a win-win-win situation for the residents, the patients, and the health centers, and we've been fortunate in tapping into a pool of dentists who have exceptional teaching skills and abilities and have been able to impart their pearls of wisdom to our residents.
It's a win for dental residents because they're able to make a difference in people's lives while getting unparalleled clinical experience in a tuition-free program that pays a generous stipend. About 35% of our graduates are offered and accept staff positions where they're trained. Patients win because they access the impossible dream: free or low-cost quality dental care right in their own community. And training site partners win because they keep the revenue generated by resident-performed procedures.
It's a win-win for them in terms of recruitment. They have an ongoing source of workforce and manpower.
Working with residents has been terrific. That's something we never imagined when we started the clinic here. But we are able to now, if you have one faculty member, multiply yourself by 12 and see many, many more patients.
NYU Langone Dental currently operates 7 postdoctoral dental residency programs.
It's a really good learning environment for the resident because there are standards that we have to meet that are part of the Commission on Dental Accreditation, or CODA. And some of those standards state that, a resident needs to do 20 OR cases to graduate. In our case, many of our residents are doing 90 to 100. The CODA standard states that the resident needs to do 25 sedations to graduate, and many of our sites, our residents are doing 65, 70, 80 sedations. So they come out really well versed and comfortable doing those procedures.
We're really proud of that model, which assures the quality of the program.
We like to call our dental residency training programs real-world experiences. What they're doing prepares them in ways that no other residency program can to be successful once they finish the program.
With more than 340 sites in the U.S. and abroad, ours is the largest postdoctoral dental residency program in the world. Our residents can choose to train in rural towns like Bessemer, Alabama, remote locations like Juneau, Alaska, urban areas like Brooklyn, New York, suburban cities like Tucson, Arizona, and urban university settings like San Francisco.
I don't think that there's anybody that would graduate from a dental school that couldn't find a residency with NYU that wasn't significant and meaningful to them. There is something for everybody.
We give them experiences in endodontics. We give them experiences in prosthodontics. They make dentures. They do the whole gamut of procedures that they learn to do in dental school, but we get them really good at it.
I think some people choose a program because of location. Some people look at the schedule and look at the rotations and look at the number of specialists that are available to train in this or that or the other, the educational experience.
We may be one program in many different locations, but we're one program.
A robust clinical curriculum comprises 75% of a resident's total experience. This translates to incomparable hands-on training, in which residents complete as many as 2,500 procedures per year in close mentorship with world-class attending faculty.
For the first 4 or 5 months, we'll work with them step by step. Then after that, we leave them alone. We watch them and make sure they don't get into trouble. And by the end of the year, they're as good as I am, or almost as good.
Yeah, I wouldn't go that far.
Almost as good.
The didactic training portion of our programs are delivered via acclaimed distance learning technologies, linking all training sites, regardless of geographic location. Residents collaborate with their colleagues in real time. They can also self-engage in learning and relearning at their own convenience.
Because of the NYU umbrella, you have experts in every field doing the lectures on that topic. When your lecture on local anesthesia is given by a dental anesthesiologist who lectures on this at a national level, then you get high quality.
There's no shortage of reasons why dental graduates looking to advance their education are passionate about our program.
I went to University of Arizona, so I love Tucson, and I actually used to volunteer at this clinic. Life kind of came full circle, and I had the opportunity to come back and work at this clinic as a dentist.
I always knew I wanted to kind of work with kids, and so I'm a giant child. I also knew I wanted to stay in New York. I grew up in Brooklyn, so it's more of a local feel for me.
I love the city. If you go to a new restaurant every single night, you'll see plays and music and shows and everything, and you can never get tired of that scene if you have enough energy to do that after clinic.
I really didn't want a 5th year of dental school. I was adamant about it. I was ready to get out of school, ready to live my life, but this has been the best thing I've ever done.
At some of the university-based programs, you have to pay a hefty amount to get your training in pediatric dentistry, but here, the stipend goes a long way to help us. The amount that I'm making here as a PGY1 resident is the same amount that I made in my entire year of private practice in Los Angeles as a general dentist at a community health center.
It was more than enough to cover my cost of living. I got to start paying back a little bit of my loans. And so it really helped.
We want them to be able to be smooth with exodontia, take out almost any tooth easily, proficiently, with good patient experience. We want them to know molar endo, something they typically don't learn in dental school, and there's a lot of need for that in private practice. We do sedation, IV sedation, and then the CEREC.
In dental school, we saw only about 2 patients a day, so 12 patients a day is a stark difference.
We do a lot of Canberra, we do a lot of gum grafting, surgical implants, non-surgical implants. Thursdays we get to work with a cosmetic dentist, and Fridays with a prosthodontist, so it's a really nice, wholehearted program.
This residency program has definitely allowed me to be way more confident in my skills.
I had an entire year where I just got to work on all different kinds of procedures and really benefit from that, and now I feel completely ready to go out into the world and learn about all the other, business side of dentistry, insurance, all that kind of stuff. So, I would highly recommend it to everybody. I think it should be mandatory, but that's my personal opinion.
I'd say a good percentage of people that I interviewed with have some sort of affiliation with NYU. It's a very well-known program within the tri-state area. I had a lot of interviews in Jersey, and I'm like even an hour and a half in Jersey. Oh yeah, I know very well. You guys are ready. You guys are equipped.
The staff here and the attendings here are phenomenal. They truly care about our learning experience. They care about us, not just as a student, but as a colleague for later on in the future.
I was a resident here, and I didn't even know that community service existed, that you could treat patients, underserved patients, and be a dentist in an environment other than a dental office. I felt that I was doing something that was significant and important.
If I hadn't gone through this residency program, I wouldn't know how much compassion it takes to treat this population.
What you'll learn the first year of dental school is what you'll be seeing for the rest of your life, the rest of your career, and what the patients are really looking for.
Millions of people without the means to otherwise access dental care have been treated by our residents since 1974. During the 2016-2017 residency year, over 691,000 individual patients received 1.8 million treatments and procedures. Our postdoctoral residency programs have helped to close the dental divide for millions of adults and countless children, too.
I have a patient named Renee, and she came in severe pain on 2 of her permanent molars.
When I eat cold stuff and hot stuff, it kind of burns my teeth.
Unfortunately, the parents could not afford the treatment that she needed, so we were able to work with my attendings and the El Rio vecinos for her to get her dental treatment, and we were able to save both of her molars, and she is now pain-free, and Mom was just crying tears of joy when we were able to help her daughter.
I like coming to the dentist because it makes me happy and they help me feel better and don't feel that hurtness on my teeth anymore.
We're just really happy with the experience that we had here with the doctors, the staff. It's wonderful.
Today, more than 3,000 dental professionals around the globe have something very special in common. They are members of an elite group of highly trained generalists and specialists. You can find our graduates practicing dentistry on Billionaires Row in Manhattan, in small Midwestern cities like Dubuque, Iowa, and in underserved communities all over the country.
I have made friendships and working relationships with people I graduated with or have met subsequently that lasted years. I mean, it really has enhanced my personal life, my professional life, way beyond my wildest dreams.
Our graduates become confident practitioners with bright futures in private practice, community and public health, specialty training, and academic dentistry.
Probably have 2 to 5 dentists call me a month and say, hey, I need somebody to come work in my office. But they want our people. They want our graduates.
Many graduates continue giving back to their communities through volunteer missions and other groups and activities they were exposed to during their residencies. Programs like Healthy Athletes Special Smiles, a vital oral health screening program run by the Special Olympics. The poor state of oral health care in America is called our hidden health care crisis for good reason. It's not talked about much. But be assured, the dental divide, separating those who can afford to take care of their teeth and gums and those who cannot, is acutely felt by millions of people every day. People in communities where we live, in towns we drive by on our way to work, and in many places we may never visit.
I have to say that I go to bed at night feeling good about what we do. While I may have the vision and the ideas, the people who are in the field execute it. And they execute it beyond what my expectations are and have been.
I love doing what I do because people are very thankful that it didn't take a crisis for them to get noticed or to get the attention that they need.
They say the eyes are the window to the soul. I say the smile is the soul, right? When you smile, I know exactly how you feel. Some people want to express so much, but their teeth are holding them back. So we're here so that nobody can look in the mirror and then look down. We want them to look up and smile bright.
My passion is finding ways to provide dental care to anybody that needs it. Zero disparities, care for everybody. It's why I do this work, and I think it's why they do it too.
The thing that gets me up in the morning is to know that I'm training the next generation of dentists. I hope that this next generation will be the one that eliminates the disparities in dental access.